This is Melissa with Blockchain WTF, and today we are going to be talking about how the blockchain is going to affect healthcare. The healthcare industry has a labyrinth of issues, from trying to decipher what is covered by your insurance, to how to pay for things if you don't have insurance, to wondering if you really need something or if you're being upsold. And why the hell is everything so expensive? Part of the issue with the industry is that it's designed by people who don't use it. Doctors are in operating rooms, not sitting around business meetings and trying to figure out how to innovate the industry. It won't fix all the issues with the industry, but the blockchain will definitely help add transparency to storage of data for patients and physicians, reduce the need for third-party data reconciliation, and will help put scientists and other researchers working on medical advancements together. Then they can share their findings about clinical trials. So, what is the blockchain and why is it so important to know about if you work in healthcare? The blockchain is a distributed ledger, and the best part is that it's decentralized, an unchangeable record of peer-to-peer transactions built from blocks and stored in a digital ledger. Whether you work in the industry or just go to the doctor once in a while, the blockchain is going to affect multiple aspects of this industry. The blockchain creates a system of trust through encryption, allowing companies to work together even though they may not trust or know each other. This eliminates the need for third-party intermediaries. Decentralized networks help with hackers who go after centralized companies holding sensitive information. This is similar to what happened with the EQUIFAX data breach. One reason this is exciting is this process will give the patient more control over their medical information, since they will own and control their own medical data. That's huge. Users could even make money selling their data to research companies instead of them just getting it without the patient's consent. It is better to have the information stored in a decentralized manner where the patient can grant doctors access versus a governmental database where patients can't access or review their information. If patients notice incorrect information has been added to their file, then another entry has to be made following the incorrect one, but that error will remain. This could help give a record of negligence if a doctor kept making mistakes. This also helps with liability if the patient goes to multiple doctors and there's a medical error. Then they can quickly pinpoint which specific entry and which doctor made the error. Currently, if you go to the doctor and they make an error in your file, you might not ever know because you don't get to review the information once you hand them the clipboard. I went to the doctor once and they asked, "How are your kids doing?" And I said, "I don't have any kids." And the lady laughed and replied, "Oh, I thought you had 4 kids, that's what it says here." That was at the gynecologist's office. Like the one doctor that should really have correct information about that part of my body. It's real scary. The only issue I see is liability. I can see a scenario where patients fail to disclose information they deem to not be relevant to their specific doctor, like mentioning an allergy. Like if you're visiting a knee doctor, you might not mention a specific allergy that you have, but not realize that the medicine the doctor was going to give you contains that allergen. The patient hasn't attended medical school and isn't aware of all the ingredients and side effects of that drug like the doctor would. And it's likely doctors' offices will come up with some sort of template of required information to be able to treat patients and refuse treatment for liability reasons if the patient refuses to disclose the necessary information. So, how will this work? Healthcare providers will collect medical data from the patient, and the data is then stored in existing databases in hospitals, and a hash is created from each source of data that is redirected to the blockchain. The patient decides who has access to the medical data, and healthcare stakeholders can query the blockchain to obtain access to the information. The blockchain can also reduce fraudulent insurance claims and provide more cost-efficient underwriting. If they no longer have health insurance, then the care provider can try and recover out-of-pocket costs, but there's no guarantees. If their information is simply outdated, it will alert the doctor's office before they see the patient, and they can update the information before they're seen by the doctor. Reducing the number of fraudulent claims or claims that cannot be paid out due to missing or incorrect information helps lower costs to the patients and the medical industry. The blockchain can even be used to track expiration dates for medicines, check equipment inspection reports. Anything that isn't HIPAA specific could be shared on the blockchain. This eliminates the need for data reconciliation with third parties that verify the information in one database matches the data in another. Besides helping patients, this can also help advancements in healthcare. Data sharing and having an easy-to-use go-to ledger to search for scientists and practitioners will allow for them to match their capabilities with someone else in a different state or country working to find cures and improve existing treatments. Shared ownership can allow scientists to upload their work and have a timestamp proof of their data, but have it open sourced, and that allows them to get credit for the starting point and have someone else finish connecting the dots. During clinical trials, information about patient demographics and information on adverse reactions can be shared so that others working on the same test can have access to that knowledge. Everyone benefits from this. I mean, would you rather take a drug that has had the same results at making somebody feel better 50,000 times or 500,000 times? There's currently a government website for this, but the processing can take up to 30 days, and there might be duplicates happening with that time overlap. Estonia is already turning these ideas into a reality. In 2016, the Estonian eHealth Foundation began using the blockchain technology for patients' health records. They also signed a joint declaration with Finland, looking at automatic cross-border data exchange for social insurance benefits and digital prescriptions. Estonia's patient portal gives citizens access to medical documents, referral responses, prescriptions, and insurance information. Individuals can use their portal to declare their intentions regarding blood transfusions and organ donation. It's not the health records that are secured using the blockchain, but the log files that record all the data processing activities performed on those records. There are a few projects working on implementing this technology that are noteworthy. Some are MedRec, Hashed Health, Forward Blockchain, and Diagnostics. Know about any other projects in the space? Put them in the comments. Don't forget to like, subscribe, and hit the bell for notifications. Thanks for watching.